So here we are preparing the eye for our procedure, and the very first thing you'll see us doing here is placing an anesthetic drop into the patient's eye. This drop helps to prevent any discomfort or pain during the procedure itself and makes the whole procedure a lot more comfortable. The next thing that you'll see us doing here is placing a piece of tape along the upper and lower eyelids, and it's primarily tape along the eyelashes. This is so that we can keep the eyelashes out of our way. And here's a piece of tape going along the upper eyelid so that we can keep the upper eyelashes out of our way. And here is a piece of tape along the lower eyelid, so along the eyelashes on the lower part of the eyelid to keep those out of our way. And lastly, you'll see we place a small little instrument along the surface of the eyelids so that we have better exposure of the eye. This instrument feels a little bit funny at first because it puts a little bit of pressure along the eyelids, but since everything is numbed up underneath, patients typically don't feel any pain. They feel just a little bit of a pressure sensation. And typically after about 30 seconds to a minute, their eye feels very comfortable and it does not feel like there's anything there anymore. This also helps to prevent the eyelid from blinking during the procedure itself. Most patients will ask us, how do you keep my eye from blinking and how do I keep the eye open? And this is the instrument that we use to gently keep the eyelids open. What you're seeing here along the right side is the view through our microscope. And that view is going to be of the actual cornea and the actual laser treatment itself. So here you're seeing that we're just lining things up properly. We're giving ourselves a little bit more space with the little instrument that we're using to keep the eyelids out of our way. And then what we're doing here is just a little bit of lubricant on the surface of the eye, and that's actually a very soft, moistened sponge that we're using to lubricate the surface of the cornea. And then you'll see in the image on the right, we are coming closer to the cornea, and we are doing something called an applanation, where we are just touching the surface of the cornea. And then that green light in the center is the centration light, so we know exactly where the center of the vision is. The changing color of the cornea is actually just air bubbles that we're putting to the cornea to create what's called a lenticule. And that lenticule is what we removed during the actual SMILE procedure. So that actual laser treatment was it. That's only 9 seconds. During that time, the patient doesn't actually see any laser treatment. There's no pain sensation. There's simply a light to look at, and that's it. And that laser treatment very carefully creates a contact lens shaped piece of tissue within the cornea. And it does it very precisely and very quickly. And now our next step is going to be to gently remove that contact lens shaped piece of tissue, which we refer to as a lenticule. And here what I'm doing is putting a little bit more numbing along the surface of the eye, and we're doing that with a moistened sponge that has anesthetic on it. And that's what we're doing right here. We're making that surface of the eye much more numb. And the reason is we're going to be needing to use an instrument to help keep the eye in place. And so on the left side, you're seeing us use something to keep the eyeball in place. And then we're using a small little instrument that's blunt on the end. It is not sharp. And we use that instrument to very gently enter that little opening that we made on the cornea. That opening is pretty small, about 4 millimeters or so. And then what we're doing here is just gently figuring out what the upper boundary of that lenticule is and what the lower boundary of that lenticule is. And so here, we're just confirming those two boundaries. So here, that's just below our lenticule. And then what you'll see is we'll use the other end of that same instrument. This is just a little bit of lubricant on the surface of the eye. And then we're going to use the other end of that same instrument, and this is a very blunt spoon that helps us to very gently separate those layers of that lenticule. And that's what we're doing here. And there we are actually entering on the above side or the top side of that little lenticule. And what we're doing here is just a gentle massage within the layers of the cornea. There are no blades here. The patient does not feel any pain during this step. actually patients just feel a very gentle massaging sensation, a pressure sensation. And those air bubbles that we use during the laser treatment are a very gentle way for us to create those planes within the corneal tissue. And so now we've completed half of that lenticule separation, and now we're doing the lower side of the lenticule. And there we've completed the lower side of the lenticule here. And again, the patient doesn't feel any pain. They feel some pressure sensation during this time as we're very gently finding out where the lower end or the lower side of that lenticule is. And here we're again just very gently massaging that part out. And then what we're going to do right here is actually hold on to that lenticule. There it is. That lenticule came out of that small little keyhole incision that we made. And this lenticule is extremely thin. And it's very important in removing that lenticule because that is how we achieve the vision correction effect of SMILE surgery. And here what we're doing is just making sure that the lenticule is completely in one piece, and that it's perfectly circular, and that it's uniform, and sure enough, it looks very good. Fantastic. And then we're going to remove that lenticule. It's not going to be a part of the eye anymore because now the vision has been corrected. And here what we're doing is using a very gentle washout. So what we're using here is a saline solution to flush out that little pocket. That's what we're doing right there. That's just a little bit of saline that we're putting inside of that little pocket that we had created. And last step, we're just making sure that little 4mm incision is perfectly opposed and sealed, and it looks great. And that's it. That's the whole thing, no more. That's the whole SMILE procedure itself. That's a little bit of antibiotic eye drops we're putting on the surface of the eye at the very end of the procedure. And these are just lubricants that we place on the surface of the eye at the end of the procedure. And then here we are removing that little instrument that helped to keep the eyelids open. And that's it. Excellent vision, pretty simple procedure, SMILE surgery.